I'm gonna wash my hands. I will be your student nurse practitioner today. How are you doing?
Good, how are you?
Good. I'm gonna have you turn your head to the left, and I'm going to begin your cardiac exam now. I would first assess your jugular venous pressure and see if I can visualize the jugular vein. I can visualize the jugular vein. I would also see it, be inspecting for the carotid artery and any abnormal pulsations. I do not visualize any abnormal pulsations, and your jugular vein is not distended. Next, I will be inspecting the point of maximal impulse. I'll have you lift your shirt up, and I'm going to keep you as draped as possible. I'm going to be inspecting the point of maximal impulse at the 5th intercostal space. There are no abnormal pulsations. Next, I'll be measuring the jugular venous pressure. So at the sternal angle with my ruler here, I'll be placing my ruler there, and I'll have you tip your head back. The patient is at 60 degrees right now, which I would like to note. Ideally, we would like him roughly at 30 degrees. So the area where the jugular vein is located, the point where it is pulsating, I would measure to. So I would add 5 to this number, which is 12, which is for your current position of 60 degrees. That is within normal limits. Next, I'm going to be palpating the carotid artery. I'll have you turn your head for me. And palpating the carotid artery, I have an amplitude of +3, which is normal, and there is no thrills. Next, I'll be palpating the point of maximal impulse. I'll again keep you draped and have you lift your shirt for me. The point of maximal impulse is the 5th intercostal space. And you have a single brisk impulse, and there are no heaves or thrills. And again, no abnormal pulsations. Next, I'll be palpating for the systolic impulse. So that is located between the 3rd and 5th intercostal spaces. And I can palpate the systolic impulse, and there are no abnormal pulsations. Next is the pulmonic impulse between the second intercostal space. Again, no abnormal pulsations. And then the aortic impulse, and that is also on the second intercostal space on the right side, no abnormal pulsations. Next, I'll be auscultating the carotid artery for any bruits. I'll have you hold your breath for me, and I'll be listening with the bell of my stethoscope. There is no bruit. Next, I'll be auscultating the heart. I'm going to begin with the aortic and the pulmonic and the tricuspid and the mitral. And again with my bell. There is no bruits. I can hear S1 and S2, and there is no splitting of S1 and S2, and your rhythm is regular. Next, if this was a new cardiac exam, I would, a new patient having a cardiac exam, I would continue my examination by listening at the apex of the heart with my stethoscope. I'm going to do this now. Okay, now I'll have you sit forward for me and take a deep breath in and exhale. Okay. There are no extra sounds. The rhythm continues to be regular, and there is, again, no bruits there. And then continuing my exam, I would like to listen at the basses as well. Okay, the S1 sound is louder at the apex and the S2 sound is louder at the bases. Again, I already said your rhythm is regular. I would listen for 60 seconds and note your heart rate, and that there is no splitting heard, and then I did not hear any murmurs. Okay, I believe that completes our exam. Thank you so much.
Thank you.